I will tell you the craziest case was a parent whose kid needed a blood transfusion, and they for a very long time refused it unless we could ensure that the donor did not receive the COVID vaccine. And like, that's not a thing. And eventually that person was convinced from with the children's hospital, like, hey, this is really dangerous. But like, that is the level of distrust that RFK Jr. and now, Trump joining the bandwagon here. That's what they're introducing into the population. And that's the potential damage they're having on defenseless people, these kids, right? They have no say in it. They're just going along. Whoever their parents happen to be, that's who they get. The other thing I'll say, just to really be critically important, I don't believe that parent at that time was trying to hurt their kid. They really believe it was a dangerous thing. I've seen kids unvaccinated come in with a fever and some symptoms, and you might, get a little worried about this disease or that one that you don't think about in other kids. These are parents who love their kids. They're not doing this to hurt their children, but they're being led to believe that these, the gold standard of pediatric healthcare, the full vaccination schedule, like somehow that's going to hurt their kids. And they think they're just really being good parents and refusing them. And it's really sad that the president now is using the Oval Office to help promote that.
Well, look, I think, I think about any kind of treatment with my own kids as a sort of cost benefit, right? Do they need this antibiotic? Can we hold off on this antibiotic because there's so many antibiotics happening, or does the kid have pneumonia and let's get it cleared up? Like, what is the risk and what is the benefit? And it seems, I think, to those of us who aren't vaccine skeptics, that the cost benefit, if your kid needs a transfusion, right? Skipping that, the cost is catastrophic.
Yeah.
Right.
Potentially, sure.
The cost of getting a transfusion from blood that potentially has COVID antibodies in it.
Yeah. Yeah.
So I want you to conjecture, but I'm not going to force you to conjecture to get in these people's minds. But what is really happening in the mind of somebody like RFK Jr.? Because I understand parents are always trying to look out for their kids, and they believe that the cost benefit is reversed of what the actual truth is. What about him?
Yeah.
What's he really?
For some portion of his career, there was a profit motive, right? He led lawsuits against, I think, particularly the makers of Gardasil, right? The vaccine that prevents HPV and prevents cervical cancer. And like, my kids all got it, right? Like, that's, but that's one of the ones. It's still on the list that they recommend. Like, the data was so clear. It's like, wow, we can actually prevent cancer. That's the insanity a little too far, apparently, for the administration. So there, certainly a profit motive. I think for a lot of the influencers, it's like the distinction of the MAHA movement, like the people who care about pesticides and food additives and having a healthy world for their kids and actually want affordable healthcare. Like, that's a group of people, like, I can get on board with all of that, right? But the influencers in MAHA world who are pushing like unproven superfoods, and before we got on, I was talking about seeing things popping up in my feed about honey, homestead honey that is supposedly okay for infants. Like this is editorial note without a doubt. Don't give your under 1-year-old honey because they could get botulism.
Everybody knows that. Everybody.
Yeah, it's crazy. And so
first thing they tell you in the hospital when that kid is born, no honey.
It feels like there is always some motive of grift and profit involved in a lot of this. And so for RFK Jr., like, having this movement, like being the leader of MAHA, I mean, he coined the phrase MAHA, but being kind of the standard bearer of so many in that movement got him to where he is as a cabinet secretary, right? I think the reporting was pretty clear. He shopped around his potential endorsement to both the Harris and the Trump campaigns. And from the reporting, Harris campaign said, no, we're not interested. And Trump, MAHA and MAGA turned out to be a pretty potent political unity to get him elected. Right now, the breakup is pretty clear as they're pushing pesticides and they're pushing vapes, flavored vapes and flavored nicotine pouches and all these things that are not promoting health, that are actually dangerous. Like, that breakup is happening before our eyes. But certainly a motive of RFK Jr. Guy got to be a cabinet secretary and get the biggest megaphone he could imagine when it comes to spreading this, the fear mongering and the disinformation.
I know, or I've read some stats that the MAHA folks, the MAHA contingent, their priorities are healthcare costs.
Yeah.
Healthcare costs.
There you go.
Yeah. I will never change that setting. Just my word. And also food additives, I think. Or basically, vaccines aren't on that list, and yet they take a huge priority with RFK Jr. You mentioned HPV, also with the white Christian nationalists have a problem with it because it's sexually transmitted and all of that. And if you get the vaccine, that must mean you're some kind of pervert or going against God. I want to play another Trump quote about Hep B, and then get your take on this.
Year one, you should have 5 separate visits.
Oh, different one. We'll get there.
In the same day. Very importantly, vaccinations for hepatitis B, COVID-19, and influenza, among others, are no longer recommended for all children. In addition, this executive order directs the Attorney General to advance legal challenges against states that violate children's rights to religious or medical vaccination exemptions for the
So, look, the Hep B is another one like HPV that is insanely sort of politicized on the right because of Hep B's links to sort of sexually transmitted diseases, and he wants the Hep B vax either eliminated or pushed to age 14 or 15. He's called it a sexually transmitted disease with no business in a newborn, he says. Now, the birth dose, I'll remind you, cut infant Hep B by 99%, from 16,000 cases to 7.
Yeah.
So what is happening? This feels like, I mean, look, measles, there's 2,500 cases, it's spiking. But Hep B is in a different class.
Yeah. Yeah, those babies are, I mean, come on, we don't have enough to say it, but they're not getting it through sexually transmitted diseases. It's vertical transmission from a mother, right? And during birth. And I mean, this is something even soon to be former Senator Dr. Bill Cassidy has lamented, right? Like the guy who gave the green light, right? Who voted RFK Jr. out of committee, who got him to that cabinet spot. He had this singular ability to deny us this era of RFK Jr. heading up HHS, and he didn't do it. I see him now kind of as, trying to kind of clear up his conscience, I guess, saying, well, had I known he was going to lie to me, it's like, come on, there's something about a scorpion and a frog, right? Like if you were duped by this guy sitting down with you telling you I'm not going to do anything on vaccines, like, shame on you. We all could see the writing on the wall.